diseases, COVID, AIDS, SARS, or plagues are probably the first ones that come to mind. Opioid addiction is not typically seen as a disease, but it fundamentally functions the same. I'm sure you or your family members have experienced some sort of illness, and being dope sick is something you want to avoid at all costs. Much like the aforementioned diseases, opioid addiction has served as a death sentence for hundreds of thousands of people. But the difference between opioid addiction and these other diseases is that the opioid crisis was man-made. Now, as someone who wants to pursue clinical pharmacy, I've spent the last 3 years just paying attention to the opioid crisis. When I say man-made, I want to point to one company in particular, Purdue Pharma. Their ruthless push of OxyContin from the mid-90s to early 2000s created a pandemic and affected the lives of millions. Purdue Pharma funded intentionally misleading research and marketing for their drug, causing millions to abuse narcotics over the years with effects that last into today. Purdue lied their way to the top of the market, prioritizing profits over general public health. They backed their claims through deceptive, incomplete research. Jason Sanchez Alonso, a writer for scholarly journal Voices in Bioethics, says Purdue Pharma marketed OxyContin as a safe, non-addictive pain reliever based on a handful of misrepresented, outdated, and narrow studies. For example, Alonso brings up a study from 1980. The author of this study testified in court that he had no idea Purdue was using his study from 16 years before OxyContin even hit the market. This was the main study used for their less than 1% get addicted claim, but it was done in a controlled hospital setting. By 2017, they cited this study 608 times. This study was 1 paragraph long. Additionally, Purdue's own studies pointed towards OxyContin having addictive qualities. The People of the State of California versus Purdue was a case that revealed Lawrence Robbins, an affiliate researcher of Purdue, found 8% got addicted to oxys in one group and 13% got addicted in another, as reported by Alonso. Purdue did away with these studies completely in favor of a survey taken in a hospital setting to continue backing up their claims. So essentially, they knew the whole time that their drug was addictive. Deceptive research contributes to deceptive marketing. Purdue heavily funded aggressive selling campaigns to sway doctors into increasing prescriptions. Their sales force and their conferences pushed the non-addictive narrative. Doctor of Medicine Art Van Zee states that Purdue ended up with 671 sales representatives, which Purdue invested $40 million into in bonuses. They were able to get 94,000 physicians on board, and each of these doctors were targeted for having high prescription rates. Now, at these conferences, they presented their misinformation as fact. I'd first like to note that they sold merch in the corner. They have a plushie of a powerful narcotic, something that appeals to children. Now, their charts, brochures, and speeches at these conferences all used misleading data and were manipulated. Here's an example. Jim Edwards, editor and writer for CBS News, reports an infamously misleading chart showing OxyContin blood levels. The shape of this graph would lead you to believe that the drug levels stay constant, preventing windows of time in which it would stop working, preventing withdrawal, preventing addiction. But if you look at the side of the graph, the increment 0 and 10 and 90 and 100 is the same 10 units, but they are completely different sizes. If you were to stretch this graph out, you would get a spiked pattern, which shows that blood levels do rise and drop off, just like any other narcotic on the market. Now, this aggressive push for profit created a pandemic. OxyContin served as a gateway drug, directly and indirectly taking lives or ruining them. Sujata S. Jayawan, a member of the Department of Clinical Sciences at the University of Houston, describes that oxys provided a euphoric, heroin-like high. He states users would crush, inject, or snort these for an instant hit. Burglaries, robberies, fraud, forgery would all take place just so people could get their hands on a prescription from pharmacies. As a result, many have died at the hands of Purdue. While not every death is attributed to Purdue, you can see their influence on these graphs. There's been a constant upward trend since oxys hit the market. In 2020 alone, 16,416 people died from prescriptions. 68,630 people died from opiates as a whole. These stats were provided from Statista by the CDC. If you were to add all of these up, you would amount to around 730 to 760,000 people dead in the past 20 years from drugs alone. in the end, Purdue was sued into the ground. But they still funded deceptive research, they still falsely marketed their drug, and they still ruined millions of lives around the nation. This injustice created one of the deadliest, most depressing pandemics to hit mankind, and it was all manufactured by one company. Opioid overdose deaths have reached an all-time high. The effects of Purdue's injustices have not only lingered, but worsened as well. In seeking profit by all means necessary, Purdue, a completely legal company, is no different from cartels nor a shady hooded street dealer.